Neglect is the most commonly reported form of child maltreatment in the United States. Like other forms of maltreatment, there are both physical and psychological signs that could indicate a child is being neglected. Some physical signs that might indicate a child is a victim of neglect include malnourishment, the appearance of poor hygiene, torn, stained, or dirty clothes, scaly skin or dark circles under the eyes, insufficient clothing for warmth and protection, or other inappropriate clothing for the weather, medical needs, such as a need for glasses, dental work, or medication that go untreated for long periods of time, and failure to thrive, or unusually low height or weight for a child's chronological age. A child's behaviors may also be powerful indicators of neglect. The types of behaviors child care providers might observe may depend on the type of neglect the child is experiencing. Some psychological warning signs include stealing, hoarding, or begging for food, constant complaints of being hungry, acting fatigued or complaining of feeling tired, feelings of extreme embarrassment, shame, or guilt, listlessness, talking about not being cared for or being alone, talking about taking care of siblings, talking about being allowed or instructed to do dangerous things, frequent absences, frequent late arrival, avoiding going home, withdrawing behavior, and acting out behavior. Failure to thrive is a condition in which a child's body does not grow at the expected rate for his age. It can be caused by medical conditions or by a lack of appropriate nutrition. The latter, sometimes called non-organic failure to thrive or failure to thrive due to social factors, is a sign of physical neglect. There are other symptoms specifically associated with failure to thrive, which according to the Office on Child Abuse and Neglect include being thin and emaciated, having limp, weak muscles, having cold, dull, pale, or splotchy skin, seeming to be tense and miserable or apathetic and withdrawn, appearing to be insensitive to pain or having self-inflicted injuries, wetting the bed at a developmentally inappropriate age, eating or drinking from the garbage can, toilet bowl, or a pet's dish, and experiencing insomnia or disrupted sleep, typically due to hunger. Take a look at the handout called What Are Child Abuse and Neglect? This document gives a very brief summary of the definitions of physical, sexual, and emotional abuse and neglect, and some of the signs you might see if a child is being abused.